The corridors of the Benta Wellness Center reflect the serenity of the Alaskan landscape. This behavioral health clinic is located in the Matsu Valley, home of towering mountains, glaciers, and abundant wildlife. The valley is also home to the Kanik tribe, which owns this clinic. Jillian Wright is the billing manager here and serves on the Alaska Native Health Board.
We serve all of Kanik tribe's population, which is mainly in the Matsu Valley, but we also serve anyone in the community that fits our demographic, which is usually youth between 6 and 23 that are under-resourced. So we are 90% Medicaid at this time. Most of our issues are anxiety, depression, post-traumatic stress syndrome. Some of that is trauma passed down from the parent.
Traditionally, behavioral health providers have been required to submit excessive amounts of paperwork to prove the need for the care they provide, creating an administrative burden. But this clinic opened in 2021 during the COVID-19 pandemic, when state regulators decided to pause part of that administrative paperwork, service authorizations. Insurance companies, including Medicaid, require service authorizations before a provider can administer treatment, and it can take up to 2 hours per patient to fill out a service authorization. Jillian was relieved that providers here didn't have to do it.
So we were really blessed to be able to not have to worry about service authorizations when we very first opened and just really focus on the child and the family.
That is the vision the Alaska Behavioral Health Association, known as ABHA, has for all of its members, providing care without encountering barriers like excess paperwork.
Behavioral health now being looked at as routine care, it doesn't make sense to then have these paperwork issues, these things that are leftover systems from before, when behavioral health was this odd duck in the healthcare system.
John Solomon is CEO of ABHA. Years before his current position, John sought treatment himself for a substance use disorder. Later, he became trained as a therapist. Those experiences motivate him to do this work, especially seeing firsthand the inequities in access to behavioral health care in Alaska.
When I needed help, I was able to ask for help and get some of the best help in the world. And that came about because of, socioeconomic. I'm a white male, all these things. I was in the lower 48, which is what we call the rest of the country besides Alaska. And coming up here, working with a lot of Native Alaskan populations, working, in really remote areas, really don't have the same kind of opportunities that I had to get sober, to get help, to get treatment. And so those are the things that I think a robust behavioral health system would help.
And there is tremendous need for more robust behavioral health services in Alaska.
There's a lot of youth that just because there aren't the services that they need in Alaska, they're being moved hundreds or thousands of miles away from their families and their culture. We just need more providers and more clinics and more money.
Barely 1 year into their roles, Solomon, Lance Johnson, who is COO, and their staff vigorously advocated for a reduction or a complete halt to excess paperwork to free up more treatment time for behavioral health providers. Their passionate advocacy was one factor that led to the state's decision to pause service authorizations during the pandemic. 4 years later, that pause is still in effect. So the next step?
Or we've started to look at our system and say, what other cobwebs are still in the system? What other things are stopping people from getting care?
The legislature is coming on board now. They're starting to understand more the importance of behavioral health. It used to be, for the last several years, federally, in the state, to be like, yes, we need to invest more in mental health services, we need to invest more in substance use disorder services, but the level of funding never matched the level of enthusiasm.
ABHA's relentless advocacy paid off when the legislature passed a mental health parity resolution, urging the state to meet federal parity requirements, making behavioral health care as accessible as medical care.
It's a tool. It's a tool to say, does this regulation help or hurt, access to care? And we want to make sure that we're doing things that are fair and equitable, and making sure that people that, like I said, I was able to get care when I needed help. When I picked up the phone and said, I need help, I got help. And everybody should be able to do that, whether you live in remote Alaska or in Anchorage or in the lower 48.
ABHA has this advice for Delta Center colleagues and other state associations fighting for parity or any health policy as they work with state health officials.
You don't want to ruffle feathers there. You don't want to seem, when you have a partner like the Department of Health or a partner like the Division of Behavioral Health, you don't want to be viewed as going behind their back and trying to force them into something. We're already working together.
Yeah, the Alaska Behavioral Health Association, or ABHA, has been a really great partner really since I've been in this role, recognizing that the more collaboratively we work, we're actually going to come together and get things done faster than if we have an adversarial role.
And strong partnerships between state health officials, lawmakers, and behavioral health providers is one key to happier, healthier residents of Alaska.